Okay, good evening. My name is Nick Pechtel. I'm a student nurse. I'm going to be starting out today by showing you my med sheets here that are complete. And we're going to identify 3 intramuscular and 3 subcutaneous injection sites, and I'm going to demonstrate where they are and how you find them. So we're going to begin with intramuscular, and we've got the deltoid, which is this muscle here, and the way you find your injection site is you palpate the acromion process, and it's the bony prominence here. You're going to put 2 fingers, and then if you stick your 3rd finger down, it creates a triangle, and that is your target area for that injection. Next, we're going to the ventrogluteal, and you can do it to yourself. It's easier on a person, but you put your hand on your palm on your greater trochanter with your thumb facing your groin, and these 2 fingers, your pointer and index, spread those apart, and within that triangle here is the space that you're looking for. And lastly, we have the vastus lateralis, which is the side of your leg. You put one hand on the greater trochanter, another hand on the patella, knee, and have the thumbs point to each other, and it's going to be this area right here between the 2 thumbs. And next we're going to be doing the 3 subcutaneous sites. The first one is the abdominal. It's going to be between the iliac crest and the costal margin. And you want to, costal margin, iliac crest, you want to stay at least 1 to 2 inches away from the umbilicus, and you're looking to get it right in this area here. And whenever you're giving a patient an injection here, you want to alternate sides each month that you give it, however often you give it, so that one side doesn't get too irritated or calloused up. Next, we're going to be doing the lateral posterior of the arm, which is the side right back here. You can palpate the acromion process, and basically the tips of your fingers back here is where you want that nice meaty spot. And the last part is the anterior, let's see if you can see it, aspect of your thigh, which is going to be between your hip flexor and the top of your knee. And you come in about a hand's length, and this area right in here is the anterior aspect of your thigh. That's the 3rd subcutaneous injection site that we're going to be identifying today. So next we're going to move into our injections for our patient. I have my medical chart here, and I'm going to clean my hands. We're going to have to go get the meds from the med room, and I'm going to confirm her orders with the orders from the doctor and what's in her chart. So we have patient Anna Pawlowski, date of birth 5/5/1957. She has a penicillin allergy, and today her orders, she's going to be having a influenza vaccination, and that should be given intramuscularly. The dose ordered is 0.5 milliliters, and I said intramuscularly. The time will be 14:58, and we are going to be using the deltoid site for that. When you're doing intramuscular injections, depending on the site you choose, you're going to want and the size of your patient, you're going to want some different size needles versus the subcutaneous. So today for this injection, we'll be using a 1 ml syringe, and 1 ml is the max amount you can inject into the deltoid of a patient, and we're only going to be doing half an ml. We're going to be using a 1-inch needle that is a 21 gauge, and typically you want to be between 21 and 23. I will be administering it at a 90-degree angle, and there should be a little bit of pain on the injection site, but nothing major, no major bleeding. And for our second order today, we've got an order for a B12 injection subcutaneously. The dose ordered was 500 micrograms. I know that there are 1,000 micrograms in 1 milligram, and the amount that was dispensed is 1 milligram per milliliter, so we are going to be giving half a milligram or half a milliliter to meet the 500 microgram amount. We're going to be doing this also with a 1 ml syringe, This is a little bit smaller of a needle. You want to use a 1/2 inch to a 5/8 inch needle. 25 gauge is what you're shooting for, and this can be given at a 90 or a 45 degree depending on the size of the patient. And any sub-Q injection, the max amount you can inject is 1 ml. So we've got that. We're going to gather our supplies and do our first 6 rights. I guess that's what I just did, but we'll do it again just to be safe. We've got our first vial here. This is influenza vaccine. It's for patient Anna Pawlowski, date of birth 5/5/1957. She's ordered to have 0.5 mLs injected intramuscularly at 14:58, and I will document this once the injection is complete, and I will also know how it was tolerated by the patient. Our second med here, we've got the B12 that we'll be doing subcutaneously. The order was for 500 micrograms, but we now know that we're going to be giving 0.5 milliliters, and we're going to be using a 1 ml syringe. It's subcutaneous. It will be given at 14:58, and yeah, I will document this as well, and we'll do some patient teaching when we get in the room, and we're going to be giving this in the abdominal area, which we just went over on how to identify and all that. So I'm going to clean my hands. We're going to gather our supplies. We've got some gloves, we've got some gauze, we've got our alcohol swabs, we've got our sharps container, we've got our meds, we've got our syringes and our needles, we've got our orders, and let's head into the room. So we're going to enter the room. I'm going to introduce myself to Anna. My name is Nick. I'm your student nurse. Could you please identify yourself? Name and date of birth. I'm going to check her wristbands. I see you have an allergy for penicillin. What is your reaction to that? It's hives, itching. Okay, that's what we have here. We are going to make sure the room is safe and the bed is in the lowest position. The wheels are locked. The handrails are up. I'm going to pull the curtain shut. I'm going to wash my hands again, and I'm going to let her know what we're doing here today. We're doing 2 injections for you. The doctor has ordered. We're going to be doing a flu shot and a B12 injection. Let me tell you a little bit about each one of those before we get to it. The flu vaccine is given to prevent the flu each season, and if it doesn't guarantee you won't get it, but if you do, it can also minimize the symptoms that accompany the flu, so it can make getting through it better for you. And during your administration, we're going to be monitoring for anaphylaxis for the first 15 minutes after it is given. We're going to be monitoring your temperature before, during, and after, and we're going to be looking for any rashes or hives. And if you feel any difficulty breathing or dizziness or anything like that, please let us know immediately. And next we have the B12, which we will be giving subcutaneously. It's given to correct a deficiency in your body. Some people just naturally have that. We're going to be monitoring a few labs before and after we give this injection. A couple of those are the plasma folic acid, the iron, the hematocrit and hemoglobin, and the reticulocyte count in your labs. We're also going to be monitoring your skin for any rashes, hives, any signs of anaphylaxis, and also check out your tongue. Let us know if that feels swollen or anything for a red or inflamed tongue, because that is a possible reaction that some people have. Any other, difficulty breathing, headache, dizziness, let us know immediately so we can correct that for you. So we're going to go ahead and draw up our medications here. Do you have any questions from me so far? No? Okay, great. So we're going to start by drawing up our influenza. I'm going to get our vial here. I'm going to scrub the top very well, and we are going to discard that. I've got the needle on the syringe already, so we're going to, without touching the plunger, we're going to draw back 0.5 mLs on here of air. I'm going to remove the top safely, and we're going to inject this into the vial, and I'm going to put the air in. We're going to turn it over without touching the plunger. We're going to withdraw the 0.5 mLs that was prescribed and get rid of any bubbles or anything that's in there. And okay, I've got that. I'm going to safely recap the needle like that to prevent any punctures, and we are going to set that aside, put the medication aside. Next up, we are going to be doing I'm going to label the syringe, and I'm pretty sure I said it before, but I've checked the expiration on both of these vials, and there are no particulates in any of it. And since they're single use, we don't need to initial time and date it. We're going to be throwing them away after our use. So we'll be pulling up the B12, and I'm going to get the alcohol swab. We're going to clean the top of that very thoroughly for 20 to 30 seconds. Okay, I've got the needle and the syringe already. Without touching the plunger, I'm going to draw back 0.5 mLs. Okay, I'm going to remove the top safely. I'm going to inject the needle into there without going into the liquid. I'm going to push the air in, and we're going to invert it, and I'm going to remove the 0.5 mLs as prescribed, and we've got that here. So I'm going to remove that. I'm going to passively recap the needle. Okay, now we have both medications drawn up. With that, we're going to get our gloves on. I'm going to sit the patient up, make sure she doesn't have any more questions. Gloves don't fit the best. We're going to sit the patient up in the bed and have the arm relaxed at her side. We'll remove the sleeve to reveal the shoulder, so we can palpate the acromion process and deltoid injection site. So I have got that here. So here is her deltoid. So we're going to, by my gloves, we've got our injection site. Before we give the injection, we're going to do our third 6 R's. We've got patient here, Anna Pawlowski. Her date of birth is 5/5/1957. We're going to be giving her 0.5 mLs of influenza vaccine via intramuscular injection. Today, 5/11/2020 at 14:58, as ordered by her provider, and I'll be documenting everything afterwards, how it was tolerated, and we should be good to go. So we've got her arm here. I'm going to get the alcohol swab. I'm going to, this is the acromion process, so I'm going to put the 2 fingers and identify where the injection site will be, which is right here. So we're going to clean, circle, and we're going to go work outward. Okay, and we're going to let that air dry. Okay, and we're going to use the Z-Track method when we give this injection, and I will demonstrate that while we do it. So I've got my injection here. I'm going to pull the skin to this, or I'm going to remove the top, set it to the side. I'm going to pull the skin to the side, and I'm going to administer. This is moving the skin out of the way so I can get straight to the muscle. I'm going to go in 1 inch, and I'm going to hold the Z-Track. I'm going to slowly inject the medication. I'm going to hold it for 10 to 15 seconds. I'm going to remove it, and I'm going to let go of the Z-Track. I'm going to place this in the sharps container immediately. In the sharps container. Okay, how does it feel? I have my gauze here. We'll put that on there. Just a little bit of blood. Does everything feel okay? Great. We're gonna just monitor for a moment, make sure everything's okay. If it doesn't feel strange at all. Next, we're gonna move on to the subcutaneous injection of the B12. So pretend like this is the abdomen now. So we've laid the patient down, and I've exposed her abdomen to where I need. We're gonna be sure to stay between, she told me that last time she got it was on the left side, so we're gonna be doing it on her right side this time. And we did the last injection on her non-dominant arm, like I said in the beginning, but just to reiterate, but last time she had this injection was on the left side. This time we're gonna be doing it on the right. She's laying supine. We're going to be above the iliac crest and below the costal margin. The umbilicus is right here. Well, let's move it all this way. Is over here, so we're going to remain at least 1 to 2 inches away from that into the fatty area. So we're going to get our alcohol. We are going to rub circularly in the middle out. Okay. And we are going to remove the needle cap. We're going to pinch the skin up, and we are going to insert the needle. And we are going to administer the medication slowly at 90-degree angle. We don't need to do the 45 with her. Okay, so I'm going to remove, and I'm going to let go, and then we're going to get our gauze again and cover that up. And I'm going to put this needle in the sharps container immediately. And you never recap used needles. You just get rid of them. So we'll put that in, cover it with gauze. It's bleeding a little bit. I don't think we need any Band-Aids. I'm gonna ask her how she feels, make sure everything is good. We're gonna do a quick assessment of her skin to make sure there's no rashes or hives breaking out. She states that her breathing is normal, and she's good to go. And she prefers to be left in the supine position, so we're going to leave her this way. I'm going to remove my gloves now, and we're going to sanitize. I'm going to ask if she has any more questions. And we're going to make sure, put the bed in the lowest position, the handrails are locked, call bell's in place. See if she needs any water or food. There's no clutter anywhere. We're going to open the curtain and make sure she's comfortable, and we've washed our hands, and we're going to just go document that both injections were given successfully in the locations we discussed. I've cleaned up all my trash, and she's good to go. So I think that is everything. Thank you.